Good evening, everybody. Thank you for having us here tonight. We are a pleasure to be here to answer any questions on this COVID-19 rapidly emerging situation that we're occurring. I want to first introduce to my left is Jennifer Tonks. She's our supervising emergency preparedness staff member, and we have Claire Prophet to her left, who is our supervising public health nurse. Thank you. We have a list of questions that have been posed to us, so we're going to get through those questions first, and then we're going to open it up for any other additional questions that any of you may have. Currently now in Schenectady County, we have no confirmed cases of COVID-19. There are currently 2 positive cases in Saratoga County, which is an adjacent county to us, but at this point we have no current confirmed cases. So far to date, we have probably sent, because it's rapidly emerging, approximately 10 tests have been sent to the Wadsworth Center in Albany for testing. And we currently have had to date approximately 25 people that have been placed under quarantine. Currently, some have been released off quarantine, so currently today we have about 8 mandatory quarantined clients, and we have 12 precautionary quarantine clients. And I am going to let Claire explain the difference between the two, because some of the terminology has recently been changed, and she has a great explanation.
Okay, so as Lisa Ayers said, as of today, we have 8 people on mandatory quarantine and 12 on precautionary quarantine. This wording was recently shared by the governor's office in the New York State Department of Health. And it's a little bit different wording than we have been using, but it should really give some clarity going forward for sort of the different risk levels of people in our community. Precautionary quarantine refers to people who have either traveled to a country that has a level 2 or 3 travel alert from the Centers for Disease Control and Prevention, or who have had proximal contact with somebody with confirmed COVID-19. And this would mean somewhat casual contact, being in maybe an institutional setting, like a study abroad where there was somebody, an associate, or they went to a conference where an associate tested positive, but they didn't have close contact like you would with a family member. The majority of the people that we have put on precautionary quarantine are people who had traveled to those high-risk countries. We've had an interesting situation because it has been so rapidly evolving. We get near daily updates from the New York State Department of Health. We analyze that information, we disseminate it to our staff, and we direct the public as quickly as possible to keep them abreast of the changes and keep everybody safe. Over the past couple of weeks, there have been a lot of changes in the language that we're using, moving from voluntary to precautionary, and who we are asking to quarantine. So at this point in time, we are quarantining. We are hearing about people who have returned from China. We hear about those from the New York State Department of Health, and starting in the future, we hope to hear about people who have arrived from Italy as well. We also hear about people in many other ways. A directive came out to both K through 12 education system and institutions of higher learning, directing that their staff and students who returned from those high-risk countries were required to do that 14-day precautionary quarantine. So we've received some of our information from the schools, and we do respond to that information and quarantine those people. Now, with the precautionary quarantine, we are asking people to do a voluntary quarantine. We follow up with them daily. We assess their symptoms. We also have them check their temperature. If those people do not follow that quarantine, we have the ability to take further steps to ensure that they are home safe in the community. When we assess these people for quarantine, we also assess their family members, their household contacts, and we educate them on in which situations those persons would have to be quarantined as well, and in which situations those persons would not be seen as currently at risk of developing the coronavirus. I think that there's been a lot of confusion in the community because of what can look like ambiguity about this. It can appear to a member of the public, perhaps that somebody should be quarantined when they're not. What we're really trying to get out to people is we are following up with people to the best of our ability when we hear about them to put them on this quarantine. There will always be people that we don't hear about. There will very likely be people in the community who return from these countries. If you think about our community and our large Italian American population, we have a lot of people who travel to Italy. There were people who came in back to the United States sort of at the ambiguous beginning period of this, when we had not viewed Italy as a high-risk country, and then we did. When we hear about these people, we do follow up with them, we assess the situation, and we do ensure that they follow this precautionary quarantine for 14 days. But we understand that there are situations where we will not hear about people. And maybe will not learn about them, and so therefore will not have reached out to them. What I have been telling people when they ask me about this, because I answer this question daily for people, is to remember that what we're talking about in this situation with the precautionary quarantine is risk mitigation. We will never remove any risk that somebody with coronavirus will come into our community and will be contagious, and other people in our community will get infected. It's just not possible. But what we do is we find as many places where we can minimize that risk by asking people to stay home, by educating them, in order to keep that risk as low as possible. And this sort of goes into the transition into mandatory quarantine. Mandatory quarantine refers to people in a couple situations. It refers to people who had close contact with a confirmed case of COVID-19. This would mean that you were in the home with somebody, were within 6 feet of them, where they could transmit those germs, the virus, to you. It also refers to people who have been under precautionary quarantine and have now developed symptoms and require testing. And at this time, as of this evening, still refers to people whose private providers believe that they need to be tested for the COVID-19, for the coronavirus. I have with me a handout that goes over this information and also goes over the qualifications for providers to order that testing that I will pass out as well. But what this means is that we rely on our providers to tell us about these people if they're testing them. And when we do, we follow up with each individual. We go to their home. We assess their home for safety of doing this mandatory quarantine. And we do give them an order from our public health director directing them that they are required to do a 14-day quarantine. So far, everyone has been incredibly cooperative. I cannot stress enough how much our community has understood the importance of this, and when we have asked them to quarantine, that they've been willing to do that, and even when we are telling them this mandatory quarantine, we haven't gotten any negative feedback from people. I know that there has been some concern from people about seeing people in the community who they believe are under quarantine. We're trying to balance two things. We want you to communicate with us. If people have concerns, our phone is always available to call. We'll take that information down and we look into it and we take it very seriously. On the other hand, remembering our risk mitigation versus removal of risk, we don't want people to feel that they have a requirement to do this if it's causing stress within their community or within their social relationships with their friends and family. A lot of times there are things going on behind the scenes that may not be obvious to the public. A big one of them is the perception that the contacts need to be quarantined. So this would mean that if we had a person who returned from a high-risk country, they would be quarantined for 2 weeks. But their family members would be directed to maintain social distancing. This would be the 6 feet separation. We would not be restricting the movement of those people. And that's not because we don't want to have more work of people who need to stay home. That's because this is best practice. In the United States, it's extremely important for us to balance people's civil liberties and their rights to continue their daily life with the need to protect public health. And with the way that this virus is being seen to transmit, it becomes more contagious as symptoms develop. So when we have asymptomatic people in the home and their family is maintaining that 6-foot distance, there is no science-based reason to prevent their family members from continuing with their daily lives. But please, everyone rest assured that we are in constant communication with these families. We are assessing the risk, and if that changes based on someone developing even minor symptoms, then we reassess the situation. Did either of you have anything to add about our quarantine?
No, I think you're pretty comprehensive.
One of the other questions that was posed to us was about recommendations for the planning of community events or attendance of community events. Right now, there is no general feedback or information from New York State Department of Health or the Centers for Disease Control and Prevention about stopping gatherings of people. We do know that some people are reviewing their own risk and their own maybe need versus, could we reschedule this versus does this have to happen now, and choosing to reschedule some of those events, and that's also perfectly acceptable. For the everyday member of the community, at this point in time, there is not a recommendation to avoid these larger gatherings. However, for people who have specific health risks, who are immune compromised or are older, that recommendation does change a little bit. And one thing I would like to specify is that when we're looking at the risk of this causing severe complications or death, the risk starts to go up after age 60, and it goes up significantly after age 80. So this is it's not obviously a 59 and it's no problem, and 60 now you need to stay home for the next month. But as you are aging and as you have more chronic health problems going along with this, it is important to, at this time, be assessing your personal risk and considering minimizing the attendance of mass gatherings or travel plans, particularly travel on cruises. That is a place where you are in close proximity with other people. And for our older population, that may not be the best choice at this time. The CDC has a wonderful section on their page, particularly for older adults. It is very helpful. I know many people I've spoken with have said that they found it quite comforting to get some of the information from there. Do you want to speak to what we've done for nursing homes?
So as far as our nursing homes and senior centers, to kind of allude to what Claire was talking about with the groups, the large groups getting together, one of our senior centers locally wanted us to come and speak to about 100 of their seniors all together, and we talked about that collectively, and we felt that maybe that was too high of a risk, so we came up with a different way to engage them. We're going to do it via disseminating information to the senior center, and maybe even setting up some kind of a conference call type of thing so that we can still meet their needs. Another thing we're doing is we're having a meeting on Thursday, March 12th, for our nursing home and long-term care administrators to go over the latest guidance on nursing homes, and that actually ended up changing today, and we're having a WebEx from the state to go over the guidance tomorrow, which is perfect because then we have our meeting on Thursday, so it's great timing. As far as school districts and municipal leaders, today we held a meeting with all of the local police departments to give them the latest guidance on keeping our first responders safe. And then we engaged our school districts, many superintendents, school nurses. It was a nice gathering this afternoon to review guidance with them as well. We also are very open to all of our stakeholders and partners. They know that we have an open door policy. They can call us anytime. So because again, like Claire and Lisa said, this is rapidly changing. We could give guidance on something in the morning, and then by the afternoon, the CDC, the state of New York have reviewed things, and through lessons learned, some things might have changed. So we have set up some distribution lists of our first responders, of our school superintendents. I'll do the same thing with the nursing home administrators to continue to disseminate that information. And then we did have another idea. I'm going to let Lisa speak to that.
We had another great idea yesterday as we were brainstorming how to bring in all of our stakeholders and keep them up to date, because this is rapidly changing. And it's hard to get everybody in one room, so we've come up with the idea of doing conference calls weekly, and we may divide it off into certain sections. First responders have many different needs, so we're going to do a conference call weekly. And with all of our big heads, as well as even our county directors are getting a lot of questions in different county departments. So instead of pulling our resources to do one-on-one trainings, we're trying to conserve our resources to be there to do what we need to do, but still to keep all of our stakeholders informed weekly. And then they can always call us 24/7, we're available. So we're trying the best that we can to keep everybody informed as this rapidly evolving situation continues.
And if anyone from the public wanted to contact you, what would be the best way to do that?
You want to get the...
So the best way to contact us at this time is by telephone. We have an entire communicable disease department who is fielding calls every day. The number for that is area code 518-386-2824. And then you can press 4 to be directed directly to that department. And we have, it's all actually public health nurses standing by to answer those questions.
After hours, we do have a 24-hour emergency line. It's a beeper call, and the area code is 518.
Well, I'm going to be honest, I will have to pull that number
I know,
up in my
I'm trying
phone
to
to share
remember.
it.
I think it's 477-7878.
I actually
Put
can.
7878,
Hold on, I
but
will.
we do have a 24-hour number, and we do get calls all hours. We are in constant communication with our health system, and I'm very impressed. Schenectady County has a really good collaboration with the health system. Dr. Liebers is our infection disease specialist over at Ellis Medicine. He's fabulous, and I have him on speed dial. We talk all weekend. He wakes me up in the morning. He's keeping me abreast of what's going on, and we're working collaboratively. They really, we were really concerned about the governor opening up testing for individuals and clogging our emergency department with people that might be just worried well or very mild symptoms. So that's not a really good use of ED, but these individuals need to be tested. So rapidly, we realized that we need to change something, and by today, they've already started a rapid, we trialed it over on the weekend with one of our clients, and they have a rapid response where the individual does not even enter into the ED. They go into the side, a back entrance, they are masked, go right into a decon room, they're done, their swabs are collected, and they're immediately out, and they can call for an appointment. We have it all coordinated. Primary care physicians are being notified. Dr. Liebers is working with all the hospital administrators. They're doing a release tomorrow. He's been in conjunction with all the primary care, trying to have it be a regional approach for all, because we know our clients go from hospital and different centers. Our borders are not closed. So we've had a real good collaboration with our health system, and I think it's much better than some of our other counties that have more health centers. We have one, Ellis, and that we've been in, so we are blessed, I think, in Schenectady County to have such a coordinated, comprehensive approach.
And Ellis actually has originally reached out to us over a month ago, and we have been working with them on planning this since long before it did reach our borders in Saratoga County. So we are very prepared. If anyone does need to contact us with something urgent after hours, that number is 518-437-7878. And then I do also want to remind everyone here that there is a New York State coronavirus hotline. This is a wonderful resource if you have a more general question about the coronavirus. The number for that is 1-888-364-3065, and that is staffed by professionals at the New York State Department of Health, as well as actually PhD candidates and Masters of Public Health students from UAlbany as well. So they have a wealth of information to share if people do have more general questions.
And they have opened this line up to be 24 hours operational. It was closing at 6, and now they bumped up to 24 hours in light of the rapidly evolving situation. And our Wadsworth lab is now testing even on the weekends, because usually that was a Monday through Friday done at 5, and they were testing throughout the weekend. I actually had staff drive specimens over on the weekend, and we got a fast turnaround. And we deployed our staff because we didn't want to wait for it to be picked up, and they got it immediately, 20 minutes, and a fast turnaround. And
How long does it take for the test to come back?
they can get it back within hours, but it depends on how many tests they have available. So they are opening it up to commercial labs to help if the capacity does expand where Wadsworth can't get to it reasonably. They have opened up LabCorp and Quest in this area, so the hospitals do have the capability sending it out to one of the other labs if Wadsworth is behind.
With the updated criteria for doing the testing and for providers to be able to do the testing without getting the permission from public health, we anticipate a much wider range of people being tested. And honestly, we anticipate we will see positive results when we do this, because this is the first big expansion of the testing. So I think that's something to remember. I like what Governor Cuomo said, that we expect the numbers in New York to go up. There is no way that the numbers will go down. They will be going up, and it's likely that they will appear in our county as well, just because it's likely that it's already been here, and the testing will now find that. And that's great, because that will allow our health department, will allow us to do our job, which is to help mitigate that spread, even though we can't prevent it.
Any questions from the members? Legislator Osterley.
Thank you so much for coming tonight and giving us an update. It's so important, and I know all of our residents really appreciate that, even the folks watching from home. So I do have a couple questions. One is just basic question. If somebody feels like they've been exposed or they might have symptoms, do they go to the ER? Do they go to the primary care physician? What do they do?
We do not want any individual just walking into a healthcare facility. So if they do feel they're symptomatic, they should call their healthcare provider and talk about those symptoms, and their healthcare provider will guide them. If they do not have a healthcare provider, they can certainly call public health, but they need to call ahead, because we don't want to potentially have anybody walking and sitting in a waiting room with potential symptoms. So they can be seen, they can be tested. There is certain criteria for testing that the doctors have to follow, and there is the 5th criteria. Even if the individual didn't travel anywhere, have direct contact, if the symptoms are consistent enough that it looks like COVID-19, a doctor has a clinical judgment, and then they will call us and let us know on those certain cases. We did have an individual over the weekend that didn't fall into that category, but this individual was sick enough to be hospitalized and had no travel, no contact, but because of the severity of his illness, we took it very seriously. He was admitted, isolated, and the testing results, and I haven't heard any positives. So.
You did mention the number of tests was relatively low, 10. So can you talk about why it's so low? I know you talked about the fact that it's going up, but that does seem really low for our county.
So I anticipate in the next couple days that number is going to go up immensely. Part of the issue that's interesting is the expansion to the private laboratories was very recent, like in the past day or so. It's possible that tests have been sent to that lab, to those labs. Right now, with the way that Governor Cuomo's orders were written, the intention is that every person who is tested for coronavirus, the public health department where they reside will be notified, and that person will be placed on mandatory quarantine until those results come back. So this is the number of people that I have on mandatory quarantine that my staff is aware of. However, I'm obviously not, beating down the doors of doctors' offices, making them tell me their patients' names. So if they had sent them to a private lab, I may not know those numbers. The other issue is that, with good reason, private providers have been uncomfortable about doing this testing in their offices. And we had a sort of stalemate where the providers felt that the safest place to do this testing was the ER, with good reason, but the ER felt at capacity, and they struggled to see people who were not ill enough to require emergency room care. Thanks to the quick thinking of Ellis, as you heard, we have facilitated there being a much faster method of doing this, and because of that, I do anticipate the number will go up greatly.
Great. And do you think that you'll be able to publish the numbers of tests that have been run in Schenectady County? Is that something we could publish?
I mean, we can try to keep the website up, but it's changing. As we came here, we had to change our numbers. Because I was in a meeting this afternoon and we had numbers that were going up and 4 more mandatory quarantine orders that needed to be signed. So, I mean, it's hard to keep something, but we could certainly work with Aaron to post them on the website. That would be helpful for the individuals to kind of.
Folks a level of comfort knowing
Yeah.
that the tests are happening.
Yeah.
Honestly.
Absolutely.
And then I think this question is a little bit more for maybe our county manager, if he can speak to what's being done in our facilities to keep folks safe that are visiting and working there.
So I can speak to a couple things. So in our nursing home, just today, 2 times, we've received kind of upages and guidance for what we should be doing to keep our patients safe, our staff safe in our nursing home. Decisions will be made about whether we're upping visitation rules. Right now, it's you would maybe call normal visitation during a flu season. Signs are posted, hand sanitizer is at multiple locations in our lobby. If someone's showing signs or symptoms, or if they've traveled to the 5 host countries, the level 2, level 3, they're basically told not to come. Names are taken, so we're trying to log in all visitors coming into the nursing home, so that if down the line public health needed to source an index of where somebody came from, we would have that information. So that's going on in our nursing home. Across our buildings and facilities, we've looked at our cleaning procedures. We just today went through and retrained all of our cleaners across the county, just for, and these are folks that already have bloodborne pathogen training as part of their job. So disinfection is actually a lower form of cleaning than that. But we reviewed procedures with them. We were lucky enough to have a new hire who wasn't assigned yet to a building or to a routine of cleaning yet. So he's going to be just on the sanitation rounds, elevators, doorknobs, faucets, all that kind of thing. We're checking in with our offices where we rent, with our landlords to make sure that they're complying with CDC regulations for cleaning. We certainly have looked at supply chains for ordering simple things like Purell, soap, sanitary wipes. And so we're ensuring that we're in stock with these things. We do have a couple places in the county where we're realizing we need a little bit more sanitation. And so we're addressing those areas as we speak. Supply chains are still pretty good as far as, if anybody here to go to Price Chopper or BJ's, you might not be able to find Purell or some certain soaps. But we're fortunate enough, the governor just announced 100,000 gallons of free sanitization products. So that is something that comes through our emergency management office. So we've already put in multiple orders there. Our goal is to be not only fully stocked, but to be ready for as long as this takes to get through our COVID-19 process. And as you've heard, we're just not sure for how long we're going to be under these increased regimen of sanitation, hand washing, using of the Purell. And I know it's been mentioned, but the single best source of not transmitting any kind of bacteria or any kind of viruses is hand washing. 20 seconds, sing your song, happy birthday twice, and it's the single most best thing you can do.
Legislator Russo.
Thank you. I want to get back to basics as well, just so I'm clear. So incubation, I don't have all the information. I'd like to make sure I understand the facts. What's the incubation period for COVID-19?
So we believe that the longest incubation period would be 14 days. So that is the rationale for the 14-day quarantine.
And so are there differentiating early signs? In other words, how does an individual know that they should contact their medical professional or seek public health advice? I have a sniffly nose, I got a little bit of a cough. That's not an indicator, or is it?
That's a great question.
Mm-hmm.
So, remembering that this novel coronavirus, which is what SARS-CoV-2, is in the same family as many of the viruses that cause the common cold. So we are seeing that there are, especially in younger people, that the symptoms that they have appear extremely similar to a common cold. And so it does become an issue of feeling out if there is some increased risk, or once you start seeing community transmission, such as they have downstate, then really widening the testing. And I think that's what you'll see here, is that we'll see very widespread testing for people with respiratory, even mild respiratory symptoms going forward.
So I just want to make sure I heard that right. In other words, it's a very gray area. At some point, if my sniffle doesn't go away after 10 days, maybe I should seek some additional support.
Well, and it's kind of a scenario that needs to be reassessed every day as we see the change from transmission being imported from travel to community transmission. So we're not actually seeing that here yet. In Seattle, they certainly are. Downstate, they certainly are. The next couple weeks will be interesting because, we had the confirmed cases in Saratoga. So we have people who could be in their incubation period. Depending on what happens over the next few weeks, we might start seeing wider community spread. Right now, if you have a mild sniffles, probably you have the common cold. In a month, that may no longer be the case. It's very, very hard to say. And so this is why I think that people in the public can get the perception that public health is changing their message, or people are telling them different things. And really what's happening is every day we have new information to give you, and we have to adapt and move with that new information. So at this time, I think if people are having cold symptoms and they have, especially if they have a concern, like they spend a lot of time with an elderly relative, or they work in a nursing home, or they just got back from a cruise or Italy, even with mild symptoms, absolutely give your doctor a call, talk those symptoms over with them, see what they're thinking. You can always give public health a call, or ask your provider to give public health a call. And we are taking that on a case-by-case basis.
Great, I appreciate that. And then for the county manager again, so special precautions, thank you for the question, Legislator Oshlich. I think that's exactly what I wanted to ask. I'm thinking about the incarcerated, though. I'm thinking about homeless shelters. Are there any special procedures that we're taking for those folks that are maybe at greater risk?
Yep, our sheriff and his undersheriffs have written a plan for our jail. It's actually pretty good. They receive guidance from Commission on Corrections as well as the Department of Health. There are a few more considerations when you're talking about a jail, but they're on sanitation rounds, with both their employees and volunteer inmates. Their supply chain seems to be good. They've, assured me that they are preparing and have prepared stockages and supplies. Obviously, they're tight with the emergency management piece. So, if we're talking about months of needing that supply chain, they're positioned well. That needs to be a place that we need to continue with that supplies. At this point, as far as any subcontractors, housing, those kind of things, it flips back a little bit to public health with meeting with our providers that work with us, our subcontractors that work with us. And there's only more to come with that. Certainly all of our folks that are involved with housing are part of that communication as well. And that was some of what Ms. Ayers was saying about, providing a place for communication, almost like a meeting WebEx to give not only these updates, which happen very quickly. I don't take it lightly that I'm saying, regs for nursing home visitors have changed twice today. So it just seems to be ever evolving and ever changing, which is fine. Everybody's doing a great job. I want to commend the Department of Public Health for really working 12-hour days and making sure that all the information is collated and given to the right people. I was able to attend the superintendent's meeting today out in Mahonison, and I know they met with all the police officers today. So, they're doing due diligence, and and it shows. As of today, we have no cases. We have 0 cases. So everything we're talking about is precautionary. Everything we're talking about is stemming any tide that other counties have not seen because of a more index case or more locally sourced case to an airport or where these things started. So we have a head start, and I'm happy to report that.
Thank you, and I do want to reiterate, I appreciate the efforts of public health on behalf of my legislative district. I'm sure I speak for all the legislators in here. Your efforts are very much appreciated, so thank you very much.
Thank you.
Any other questions? Do we know how long the treatment takes and how long the coronavirus generally lasts once?
Well, there's no treatment right now because the vaccine and antivirals are being under clinical trials, so that takes time for clinical trials and the processes that we have in the United States. So it's just supportive care. And like we said earlier, 80% of the cases are very mild. People can stay at home and just do what they would do with a cold fluids. If they have a fever, Tylenol or ibuprofen, and just resting, eating good nutrition, getting good rest.
It generally lasts a period of 2 weeks or 3 weeks.
So that really depends on,
Depends on the person's
yeah,
the severity, the comorbidities, the age. You know, if you're going into pneumonia and you're 80 years old and you have congestive heart failure, you may be in the hospital ICU. If you're younger and less comorbidities, you may get over it. So it's not a
Not a black and white
No.
answer.
and
gray.
there's a protocol in place to clear people once they have tested positive. So it's 2 consecutive negative tests from a NP, a nasal swab and an oral swab. So that is clearly delineated, and we will follow that process if and when we have positive cases.
Do you have any other questions? Thank you very much for all your hard work, and
Thank you.
we're in good hands.
It's our honor.